Simply stated, there can be no health without mental health. Hence, in this lecture, we shall examine what mental health is and how we can promote it across the lifespan. We shall examine some of the major theories related to the origins of mental health and disorders, and also how they are currently classified. So, let's begin our learning adventure. Simply stated, there can be no health without mental health. Mental health is intrinsically indispensable and a critical component of health and well-being of individuals, families, and entire communities. The Public Health Agency of Canada defines mental health as the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face, and a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. The WHO definition is also somewhat similar. It defines mental health as a state of well-being in which every individual realizes his or her own potential. They can cope with normal stresses of life, they can work in a productive and fruitful manner, and they're able to make contributions to his or her community. This concept of mental health embraces promotion of mental health well-being, the prevention and treatment, as well as rehabilitation of individuals affected with mental illness and disorders. Mental health, it may be argued, is a necessary resource for living a healthy life and a critical factor in overall health and well-being that involves striking a balance in all aspects of oneself, including social, physical, spiritual, cultural, environmental, occupational, economic, and psychological components. So here is a promoting mental health. This is a personal example. So we all have to do things to promote our own mental health and well-being. So for example, I enjoy building my own furniture. So on the top left-hand corner here, you can see a trolley that I actually made, and all of the kitchen cabinets. I've actually did that also. And below is a colonial style bed, which I also built. So I enjoy doing carpentry, working with my hands. I also enjoy various water sports, doing snorkeling or scuba when I have the opportunity, stand-up paddle boarding or kayaking. And of course, I enjoy traveling abroad with my family, exploring new places. And lastly, I really enjoy playing the electric guitar and writing my own rock music. Here's another example that may promote mental health, Tai Chi. And you know that Tai Chi is really an ancient form of martial arts, which dates back to over 700 years ago. And it consists of slow breathing and movements, visualizations, and relaxation of the entire body and mind. And there is empirical evidence to suggest that Tai Chi is in fact an effective means to decrease stress, to lower one's blood pressure, and to improve mental and physical health as well. The Mental Health Commission of Canada was created by the federal government in its budget of March 2007 with the goal of creating an integrated mental health system that places individuals living with mental illness at its center or core. And the Mental Health Commission of Canada reports that approximately 6.7 million people in Canada are living with a mental health condition or illness. There are 6 priority strategic directions here. First, to promote mental health across the lifespan in homes, schools, and workplaces, and prevent mental illness and suicide wherever possible. Foster recovery and well-being for people of all ages living with mental health problems and illnesses, and also uphold their rights. provide access to the right combination of services, treatments, and supports when and where people need them. Fourth is to reduce disparities in risk factors and access to mental health services and strengthen the response to the needs of diverse communities and Northerners. Work with First Nations, Inuit, and Métis to address their mental health needs, acknowledging their distinct circumstances, rights, and cultures. And lastly, to mobilize leadership, improve knowledge, and foster collaboration at all levels. So here we see an example I wanted to put up of how First Nations people engage in various mental health practices. And here on the right, you'll see a shell with some sage and cedar put in for smudging. And smudging ceremonies where negative energies, feelings, and emotions are believed to be carried away by the smoke. And it is often employed by First Nations individuals to promote healing and cleansing of the mind, body, and soul of First Nations people. The Mental Health Commission of Canada has identified the need to work with Indigenous people in Canada to address their current and emerging mental health needs while acknowledging their distinct circumstances, rights, and cultures. There is also some social determinants of mental health, and there are really three critical ones here from the Canadian context. The first one involves freedom from discrimination and violence, social inclusion, and access to economic resources. So let's look at mental health from a Canadian perspective or lens. Well, each year, 1 in every 5 Canadians experiences one or more mental health problems, so it is considered a major non-communicable disease in Canada. It also creates a significant cost to the health system of over $50 billion annually. Here we see the top 6 mental health disorders affecting Canadians. Depression is on top of the list. Bipolar disorders, generalized anxiety disorder, alcohol and substance abuse or dependence, cannabis abuse or dependence, and other drug abuse or dependence. At the end of this lecture, you will see a recommended reading where these particular disorders, depression, bipolar disorder, generalized anxiety disorder, and others as well, such as schizophrenia and anorexia nervosa, for example, are described in detail. Here on the right, you see an electroconvulsive therapy, or ECT, device, which was first employed clinically during the 1930s. It is still being employed for treatment-resistant cases of depression and also in certain cases for bipolar affective disorders. So let's look at mental health of Canadian workers as well. Well, here are some really startling statistics. 21.4% of the Canadian workforce is currently experiencing mental health issues, or 1 in 5 if you wish. 30% of disability claims are due to mental health problems, and it also has some huge economic impacts, which are estimated to exceed $51 billion annually as well. So is mental health just an issue for adults? Well, absolutely not. In fact, the empirical literature demonstrates that approximately half, or 50%, of mental illnesses begin before the age of 14 years of age. School-based mental health promotion. Well, schools are an effective means to provide developmentally specific and targeted mental health promotion to children, with the specific aim of encouraging children to remain active during and after school in their communities. There are 3 major theories related to the origins of mental illness and disorders that we will explore. First one is supernatural theories, psychogenic, and somatogenic theories. So what are supernatural theories? Well, these are of course, one of the oldest ones that we're aware of. And they attribute the development of mental illness or these conditions to the possession and or punishment by evil or demonic spirits, displeasure of gods or deities, solar or lunar eclipses, comets, curses, and or sin. The supernatural theories are still prominent in many parts of the world. Trephination example here. Here you see a skull on the right with certain holes born in it. This particular practice involves surgically putting a hole into a patient's head with the belief that the evil spirits would, of course, exit the head. So trepanning or boreholing is a surgical intervention where a hole is drilled, incised, or scraped directly into the skull. And it was one of the earliest treatments for mental illness, of course, associated with possession, and also for treatment of epilepsy, which was also believed to be a form of demonic possession in early times. The second theory is called the Psychogenic Theories, and they focus on traumatic or stressful life experiences, maladaptive learned associations and cognitions, or distorted perceptions of realities. So some of these traumatic or stressful experiences, for example, may involve surviving a tsunami or hurricane, severe flooding, divorce of parents as a young child, sudden death of a loved one, physical violence and abuse, rape, and or war. Well, psychogenic theorists and approaches, of course, there are some noted leaders here who have brought this sort of psychogenic theory forward. Of course, Sigmund Freud, Alfred Adler, Carl Gustav Jung, and their disciples influenced much of 20th century treatment of clients with mental illness and disorders. The clinical management and treatments include things like psychotherapy, psychoanalysis, and psychoanalytic techniques. The third one are somatogenic theories, and they identify disturbances in physical functioning resulting from either illness, could be due to genetic inheritance, brain damage or trauma, as shown in this photo to the right, for example, or chemical or force of nature imbalances. So here's an early example of a somatogenic theory. So around 2700 BCE, Chinese medicine's concept of complementary, positive, and negative bodily forces, or yin and yang, as shown in this photo to the right, the symbol for it. So they attributed both mental and physical illness to an imbalance between these noted life forces. There is also a current chemical imbalance theory of mental illness and disorders, which has been propagated by psychiatrists and by their pharmaceutical industry as well. For example, it may be argued that propaganda from the American Psychological Association and the pharmaceutical industry, which targets healthcare consumers, psychiatrists, and physicians directly, has led the way in advocating this chemical imbalance theory for depression. So you'll see here in this table various medications shown on the right and selected content for consumer advertisements. So the first one, Cilaxa, helps to restore the brain's chemical imbalance by increasing the supply of the chemical messenger in the brain called serotonin, right? And etc. going down the list. So they want to advocate or propagate the idea that depression is solely attributed to a chemical imbalance in the brain, which of course can be corrected through the use of various pharmaceutical agents as opposed to other etiologies or factors, risk factors, or causes. What is stress? Well, we define stress as a very unique and subjective perception or reaction to a specific current existing or imminent situation or condition that results in emotional and psychological responses resulting from various demands, expectations, and or unpredictable circumstances experienced in our daily life. What is the stress response? Well, we define the stress response as the individual's reaction to a specific stressor. There is also different forms of stress. There is acute versus chronic forms of stress. And although acute forms of stress are often more intense in nature, the empirical evidence is suggesting that the chronic forms of stress actually have the most negative health outcomes associated with them. So stress can be seen sometimes as positive when it's an acute in nature and of limited quantity. For example, studying for an upcoming quiz. However, when it comes to chronic and excessive stress, it can lead to negative health consequences. So examples might be things like extreme poverty, homelessness, or chronic unemployment. Stress and coping mechanisms overload example. Conflicts, war, and natural disasters that include earthquakes, tsunamis, hurricanes, flood, and fire can result in stress overload when traditional coping mechanisms are overwhelmed or are insufficient to meet current or emerging demands on the individual. So when we look at stress, there are two types. Stress can be either positive in nature, which we refer to as eustress, or negative in nature, which we refer to as distress. So what is eustress? Well, it's regarded as positive stress that presents the opportunity for personal growth, satisfaction, and new and desirable life experiences. Examples include getting married, starting university, beginning a new career, learning a new language, or perhaps learning to play a new musical instrument. This is the Yerkes-Dodson Law, and here you see a graphical account. And on the left, we see performance, low to high, 0 to 20, and also stress level, assessed from a scale of 0 to 20. So this law is often illustrated graphically as a bell-shaped curve, which increases up until the point of 10, and then decreases with higher levels of stress and arousal. In other words, individuals are able to cope up to a certain point in theory, and after that, stress starts to overwhelm them, and there starts to be negative health consequences associated with these high levels of stress. What is distress? Regarded as negative stress that consists of unpleasant situations or experiences. For example, cyberbullying, death of a loved one, job loss, loss of home due to fire or a natural disaster, being diagnosed with a life-threatening health condition, such as cancer, for example. If this stress is not controlled and managed, it can result in physical and or mental health issues, illness, or even death. There are various neurochemical links that have been associated with the threat stressor shown in this diagram, and it does affect various body systems. You'll see on top the central nervous system, the endocrine system, and the immune system depicted. So stress activation of these systems may also affect other body systems, notably the cardiovascular system. For example, it can result in increased heart rate, stroke volume, and cardiac output during times of stress. Blood vessels could result in peripheral vasoconstriction, redistribution of blood to vital organs. In the respiratory system, of course, increased respiratory rate, and in the gastrointestinal systems, such as increased glycogenesis and decreased digestion happening. And you'll see various letters A, B, and C. A are neuropeptides, B are endocrine hormones, and C are cytokines. General Adaptation Syndrome Model, which describes how the human body moves through 3 stages when confronted by stressors. We have the alarm reaction stage, a resistance stage, and eventually exhaustion stage if the stressor still remains present and the individual is unable to utilize their coping mechanisms effectively and deal with that form of stress. Typically, we are referring to chronic forms of stress here. We also have the fight, flight, or freeze response that often takes place. And on top of this particular diagram here, you'll see a threat stressor being present. The brain will process the signals here, and then, of course, there are a whole series of various hormones, etc., that are released. For example, in the pituitary gland, it secretes ACTH. Cortisol is released, or catecholamines may be released, and there's various physical effects that are instigated, such as increased heart rate and blood pressure, respirations, dilated pupils, your face may become flushed, and of course increased mental alertness as well. And of course the individual can engage in 3 sort of outcomes typically. They can fight, the fight response, flight, meaning they could try to leave from the stressor, or they actually freeze up during that moment. What is allostatic load and allostasis? Well, allostatic load is defined as the wear and tear on the body, which accumulates as a function of time due to chronic or repeated episodes of stress that result in fluctuating or heightened neural and neuroendocrine responses over time. Allostasis is defined as the process by which the body responds to stressors in order to regain stability or homeostasis. So what are some of the health consequences associated with excess levels of chronic stress? Well, high stress levels and allostatic loads have been linked to an increased risk of developing heart disease, hypertension, obesity, diabetes, certain forms of cancers, sleep disorders, depression, recurrent seizures, and impaired immune system responses, to name but a few. Here you see some different types of personality types and how they respond to stressors. So type A here, individuals are typically very highly controlling in nature, they're ultra competitive, they're impatient, often aggressive, confrontational, hostile, or abusive. These individuals tend to have higher perceived stress levels and more problems coping with stress. This particular personality type was first described as a potential risk factor for heart disease during the 1950s. Type B, individuals are generally more relaxed, laid back, easygoing. These individuals tend to be better at relaxing without feeling guilty, or working without becoming over anxious or agitated. They tend to have lower perceived stress levels in comparison to type A, which we described above, and they may enjoy achievements, although they have greater tendency to disregard physical or mental stress when they do not achieve. Type C personalities, here individuals with this type of personality tend to be introverts and are characterized by the suppression of anger and feelings. They prefer to be alone. They appear to be lacking emotions often. They characterize themselves as being perfectionist in nature, often have feelings of hopelessness. They suppress their wants, needs, or desires, and they usually don't assert themselves. They often find it hard to work with others, so they prefer to work on their own. They tend to have exaggerated responses even to minor stressors, and these heightened responses may impair their immune function. Over the long term, this can bring about high degrees of frustration, anger, and stress, which often may lead to the development of depression. And it was proposed back in the late 1980s that type C personality types were maybe more prone to certain types of cancer as well. Type D is a relatively new personality construct where individuals tend to have joy tendency towards negative affectivity, anger, contempt, disgust, guilt, and fear or nervousness, and social inhibition. There is often a lack of self-assurance, for example. These individuals often possess a negative outlook on life, are gloomy, socially inept, anxious worriers who live in constant fear of rejection by others. They tend to be pessimist in nature and overall negative in nature and expect the worst to happen to them. The letter D stands for distressed here with this personality type. These individuals tend to have an overall negative outlook on life and live with a constant fear of rejections by others, resulting in chronic levels of stress, which may make them more prone to development of certain non-communicable diseases, of course, like chronic coronary heart disease, diabetes, and major depressive disorder. Coping and managing stress. Well, coping is defined as an individual's cognitive and or behavioral attempts and resources to manage specific physiological or emotional / psychological stressors that they are confronted with. Coping resources are defined as internal and external assets, characteristics, behaviors, their problem-solving skills, and or actions that can be employed by an individual to manage a stress response effectively. Here's an example. We'll refer to laughter is perhaps one of the oldest medicines. You see a street mural here in Georgetown, Malaysia, with Mr. Bean, of course, on a bicycle here. I snapped this picture. Well, laughter can actually boost your spirits by producing changes in the automatic nervous system. It decreases stress hormones and stimulates immune function and the production of infection-fighting antibodies. So laughter is in fact has very positive outcomes. It also triggers the release of endorphins, which are the body's natural feel-good biological opiate peptides, which also provide temporary relief of pain and discomfort. There are a variety of internal and external coping resources, and this table here provides some examples. So on the left here, we see the internal resources, maybe involve things like effective communication skills, ability to identify problem and collecting appropriate information, high moral standards, spirituality, effective social skills. For external resources, the individual may have strong social network of friends, family, and co-workers or contacts. They have a positive financial resources, knowledge and willingness to accept social agencies in workplace or community, and also access to the use of various self-help websites, books, community workshops, or seminars, for examples. So here's an examples of some stress management techniques that have been documented empirically to help individuals. Animal-assisted therapy. So they may bring in pets which have been specially trained. Dog, cats, even horses or larger animals are often used here. Art therapy for self-expression, community-based social or self-help support groups. Exercise and being physically active has also been shown to lower one's stress levels and have positive physical and mental health outcomes. Guided imagery, hypnosis or hypnotherapy, keeping a journal or diary, massage therapy to promote relaxation. Massage therapy also promotes circulation into the area, of blood into the area to promote healing. Mindfulness, music therapy, relaxation, breathing, and yoga, to name but a few. Here's a suggested additional reading. It's in chapter 11. It's entitled Current and Emerging Mental Health Issues in Canada. It also details various mental health disorders and diseases such as schizophrenia, bipolar disorder, anorexia nervosa, etc. in this chapter that may be of interest to our viewers. Well, that's all, folks. I hope you enjoyed this lecture related to mental health, and I hope that you listen to other mini lectures in this series related to the art and science of public health. Cheers.